I see a lot of you here interested in biofeedback. Welcome. Good afternoon. Welcome to our panel discussion on biofeedback and wellness. I'm Yang, VP at Joyance Partner, and I'm your moderator for today. So before we dive into our panel discussion, I would love to know, have any of you heard about biofeedback or have already adopted it in your day-to-day lives? Raise your hand. Yeah, that's a fairly good amount of you, about 50%. I'm sure you're here very well prepared and want to learn more about biofeedback from our expert panelist. So biofeedback is a rapidly evolving field that is transforming how we understand and interact with our bodies. With the biofeedback market projected for significant growth, it is clear that it is having increasing relevance to promoting our health and wellness. So today, we are fortunate to have our 3 expert panelists at the forefront of this transformation. Welcome, Rameen, Frans, and Antoine. Could you give a little short introduction of yourself?
Awesome, happy to start. Like she said, my name is Rameen Rana. I am an investor at Samsung Next. We invest broadly in areas that Samsung cares about, ranges from AI and robotics to consumer services and, very importantly, healthcare. I spend all my time leading our healthcare investments, and within that sector, there are a couple focus areas. One, care at home. The idea you have a lot of devices in your home already that are Samsung. How can we leverage those to make a more connected healthcare ecosystem? And then, especially pertaining to biofeedback and wellness, we have core pillars of sleep, fitness, nutrition, and stress. So we really think about how we can incorporate new data points in those 4 core pillars and provide more personalized recommendations and insights to our over 60 million monthly active users on Samsung Health. So excited for the discussion.
Thank you. Hello, my name is Frans Folkvord. I'm a professor at Tilburg University, and I'm also the co-founder and director at PredictBy. I'm a psychologist and sociologist by training. I'm mostly focusing on behavioral science implementation. We also do a lot of projects for the European Commission, trying to better understand how these digital technologies actually are implemented and if they are effective, and also how we can better understand the user by improving the technology to use behavioral science to actually implement the technology in such a way that it has the biggest impact. So this is also what I will be talking today to you, but now I give the floor to Antoine.
Thank you, Frans. Happy to be here with you. My name is Antoine. I look after our B2B division at Withings. Basically, we are a connected device company. Our main mission is to improve remote patient monitoring and to find the best way to monitor people. And we mainly focus on chronic conditions and cardiovascular risks. And so we are working with a lot of different actors like health insurers, pharma groups, hospitals, etc. So happy to be here with you today.
Thank you. So to kickstart our discussion, I would love to ask each of you your views on the general landscape of biofeedback technology, especially on its potential applications in health and wellness.
I'm happy to start. I think there's several trends that we're super excited to dive into in this field. Just to highlight a couple, I think one, especially at the intersection of biofeedback and mental health. I know Frans has some incredible research on that as well, so we'll let him take it over. But a couple companies that we've engaged with pretty heavily. One's called Mind Mics, use in-ear patented technology to better analyze subtle variations in HRV and provide kind of breathwork exercises and other visual signals to better remediate some issues that patients might have in this space. I think another very near and dear to our thesis at Samsung Next is within elderly care and senior care. As you can imagine, we're really trying to focus our thesis around aging in place and bringing care out of the hospital and into the home. And there's some incredible biofeedback research around using wearables and multimodal biofeedback models to help with gait analysis, as an example, using different visual and auditory signals to help prevent falls for seniors, as well as even music-based biofeedback to combat loneliness amongst elderly populations. And I think the last new trend that we found really interesting is across the intersection of biofeedback in conditions like ADHD. Saw even some companies here, I think PigPug was one of them, that's working in the space. But the idea of using these electrical headsets and gear to better analyze users' focus and then try to think about how they can adapt potential learning techniques after, like MindLift, Brain Hero, some phenomenal companies doing work in the space that we love to track as well.
Okay, thank you. Yeah, I agree. I think that we are now in a time zone that we have developed all kinds of different technologies and methodologies to be used in healthcare to improve it. I also work a lot with the European Commission, especially on, for example, the European Health Data Spaces, but also on the Data Act, the AI Act, trying to see how we can develop the framework to implement all these technologies in a very effective and successful way. But one thing that we also notice is that we sometimes forget, and there was actually a very nice session before about the overselling of the digital technologies. And this is also something that happens with these technologies. We work with companies in different projects with augmented reality, with virtual reality, and they have really a big promise in the future to improve the way we live our lives. But at the same time also, I bet you if you now go on the streets and ask many people about AI, about machine learning, about large language modeling, about biofeedback, I think that many people on the streets have no clue. So we are now also in some kind of echo bubble where we all have an understanding about what we're doing and what we want to do. But in the end, if we do not reach the mass population to implement it in a very effective and an efficient way, it will also be an overselling of these technologies. So all these things that we know, because we are working with this on day-to-day basis, we need to also understand to be able to implement them on a mass scale, and then we mostly work within the European Union, but of course we also have countries outside the European Union. We need to better understand how we can use these technologies for the consumer or the citizens or the patients at best use. This is also what we try to do in several projects. We do co-creation, we do stakeholder engagement sessions, we have design thinking methodologies, all put in place to know exactly that if we build something, that the user will also will use it. And not only adopt it, but also use it over time. I make a joke because I run marathons, so I use Strava, for example, a lot, because I use it for my training and to keep also updated about how I'm doing. But I also have friends that want to use it, and they use it in January because they have good intention for the new year. But then in February, I see them already getting lost on Strava. I already see someone laughing there, so I think that she also recognizes her friends doing this, of course. So we need to make sure that if we build something, it is useful, it is used, and is also effective in the utility or the objective that we plan to use it for when we're developing all these tools. But maybe Antoine, you can criticize or compliment or...
No, I think it's very interesting. Yeah, of course. I mean, I think, just to answer very clearly your question, Young, it's we are at a stage where it's very, very easy to use devices that collect biofeedback. So, for instance, my watch will tell me in a few minutes if I'm doing AFib. I hope not, but it's passive. I mean, you just have to wear something to step on a scale, and it will tell you if you potentially have hypertension, diabetes, and so all of this, it's amazing in the way we are using devices. I mean, everybody can use them. And now, as you said, Frans, it's very important to ensure that we educate people on using this on a long-term period, and also analyzing the data in a good way. We have seen a huge shift in the last 5-6 years on adoption of these technologies, either on the consumer market as well as in the healthcare systems, where now we see that it's even like people going to their doctors, and we have doctors, mainly cardiologists, contacting us every day, saying, "Oh, my patients showed me your ECG graph. It detected AFib, for instance. That's amazing, but I want to learn more. I want to understand what it is. Is it good enough? Do you have the regulatory things, etc." So there is a right balance to find, but I think it's an exciting thing to see that it's becoming like a common thing. But of course, a lot of data are collected right now.
Well, thank you for all the insights. So as challenges always accompanies innovation, what would you say is the biggest barrier for adoption and acceptance of biofeedback technology in the mainstream healthcare?
If I may go first, I think that many healthcare professionals, at least in the project that we do with them, they are overly busy. So they have a lot of things to do. They already have a limited time to spend on their patients, which is what they actually chose when they were younger, when they started to do their educational training to become a doctor to help patients. Now they only have 10 to 15 minutes per patient. They already have to do a lot of administrative things, at least in the Netherlands, but I think that is the same in other countries. So to make something, because you can have a perfect solution that works really well, you have all the clinical evidence that this is very effective. In order to be able to implement this in the healthcare clinical workflows, you need to also understand the people that work in this workflow and how to motivate them or train them to use it. Of course, regulatory, if you push them by regulations that they need to use it, which of course is the strongest weapon that you can use, but this is very difficult. You need to find other strategies, and this we call behavioral understanding, to see when they are going to use it, how they're going to use it, how you can motivate them to keep using it. So I think this is the main barrier that we at least face. If we develop something very useful to bring it to the market, to be used or to be sold, you need to understand them, how to use them and when to buy it.
Yeah, and if I could just add on to that, I think I 100% agree. I feel like when we think about consumer businesses and how to convince a consumer to use a product, we think of me and you as users. But in this situation, it's the providers that would be using the product and really have to get that buy-in. So I couldn't agree more that that physician buy-in, figuring out how to implement this solution into their clinical workflows when they've been trained a certain way for who knows how many years, is often such an uphill barrier. And when it comes to that consumer buy-in of me or you using a biofeedback application, the way we'd get convinced is our provider in itself, right? So before we get that buy-in, the provider needs that buy-in first. So I couldn't agree more on that. And then I think additionally, just more and more kind of clinical validation and data validation, right? When it comes to a lot of solutions that are out there, I think to your first point as well, it's very easy to say what you're doing, but having kind of the clinical backing along that takes a lot of time. It also takes a lot of money, which is something we see in kind of the funding landscape as well. So we'd just add that as a potential challenge. And then to round it out, like payment models can be really tough in this space as well, right? Obviously, like CPT codes technically exist, but like they're really murky territories. So are you expecting a consumer to be paying out of pocket for this? Are you expecting a healthcare provider or the health system to be paying for it? These are really hard challenges for sure to tackle.
Yeah, and to complement this and maybe to give you a very concrete example of what you are exactly saying, if we are taking the example of the heart failure monitoring programs, we have to take into consideration that the beginnings, like connected devices, they have been made for tech people. I can imagine you going to the Apple store, buying a watch, connecting into the iPhone, but ask someone that is 75 years old, which is the average for people having heart failure, to do this. So for us as a company doing like devices that collects biofeedbacks, we need to adapt as well the way to use those devices. You cannot ask people that have never used a smartphone to download an app, create an account, connect in Bluetooth, blah, blah, blah. So we need to understand exactly the healthcare professionals to not overload their daily jobs, but we also need to understand the people, the patients that will use those products, and it will be the key for retention and to use those devices and as well as engagement as well. Yeah.
Thank you. That's an insightful discussion. So it's clear to us that biofeedback obviously holds immense potential, but it also has a lot of challenges to address. So with that background in mind, I would love to dive into your specific expertise and how that apply in the biofeedback market. So Professor Folkvord, could you tell us a little bit more about your research in biofeedback technology in cognitive processes and your insight from the European project you're doing?
Yes, sure. So we now started a new project together with many partners from Europe, mainly focused in Austria, where we actually work together with a company using virtual reality to build augmented reality in this use case to help the healthcare workforce, especially nurses, to better be able to cope with stress, to be better resilience to mental stress. Because during the pandemic, we saw that there was, of course, a huge amount of stress that was pushing them to their limits. And this is not only during the pandemic, because many reports already showed that they are under a lot of pressure, and we actually need more healthcare workers. So we cannot lose the ones that are now working in the healthcare sector, especially nurses. So what we try to do is we try to build together with the nurses across 7 pilot sites in Europe to build together this augmented reality. So how does a situation or a context that they perceive as very stressful look like? How can we build this with the technical people in a sort of augmented reality version that if they use these VR glasses, they can perceive the situation as real? And how can we then train them by different psychological training sessions to be better able to cope with these stressful situations? And as a sports psychologist, I also supervise many top athletes. Of course, you cannot simulate the real stressful situation that somebody is entering the ER. You need to decide now what to do. And maybe, especially if it's a young person, you feel a lot of different emotions during these seconds. So you cannot simulate reality, of course, with augmented reality. But we now also, what we just discussed, these developments, they go so quickly that this augmented reality looks really and is really perceived as a situation that is almost real, that you can use this to simulate the situations to train them most effectively. And of course, we do this to help them to be better able to cope with these stressful situations, in order to hopefully, when we finish, we have a validation of these tools and then use it also in different environments. One of the things is also climate change. We know that people have a lot of cognitive biases. They cannot think about the next 5-10 years what will happen. So we try to use this augmented reality to make them experience quite severe climate change consequences, to make them more engaged and aware of the things that can happen in a few years, actually, to overcome the cognitive biases that we as people have.
Well, so we moving from a research pilot into commercial application. Antoine, can you share us a little bit more about how Withings incorporate biofeedback in its devices and how you work with health insurers in health prevention programs?
Sure. I can take the example of primary prevention, for instance. The key here is at least in Europe, or the health insurers. We are working more and more with them to create prevention programs that they can offer to their members or to the employers for the employees. And so we are creating like very simple programs where we just select one device that collects a lot of data points, so it can be like weight scale, for instance. And we are creating like scores of risks. Just by stepping on the scale, you can say, okay, there are some very medical feedbacks like pulse wave velocity that can build, it gives you an idea of the stiffness of your heart disease. So it can give you an idea of the risk of doing hypertension, for instance. And you can also detect like electrochemical skin conductance, which is like the detection of peripheral neuropathies, which is a complication for diabetic people. And you can do all of this just by stepping on the scale. So it's kind of a simple gesture. And so we are working with health insurer to create kind of primary prevention programs, mainly you understood on chronic condition and cardiovascular risks. And so we added to this like programs. That's where your work, Frans, is very interesting, to help people to keep going, engaging with the device, using those devices on the long term, and understanding what does the data mean and how we can improve it. We are working a lot on this primary prevention part with health insurers, and we combine this with like a group of nurses that can proactively contact the members of the insurer if the trends are not going in the right direction. So that's a very concrete example of what we are doing.
Thank you. Then we're moving into, as an investor, Rameen, what do you see as the biggest trend in biofeedback technology, and what are the promising opportunities that investors should look at right now?
Absolutely. I think something that we're obviously a little biased, given that we're such a large consumer tech company, that we're very excited about is increasingly giving access to consumers, increasingly giving access to healthcare to these consumers in their own homes. So a concrete example of that is how to leverage wearables more into the application of biofeedback, right? So when it comes to Samsung, obviously you have our watches, just released a new bioactive sensor a couple months ago to better detect and analyze trends of AFib, low blood pressure, HRV, even body composition analysis as well. Recently launched our Samsung Ring as well to really hone in on this 24/7 health monitoring techniques. Samsung Ring is specifically doing some really interesting work incorporating biofeedback with regards to stress in particular. At the end of the day, the idea that wearables are just being used to detect step counts is far a thing of the past. So the idea of really leveraging biofeedback into wearable technology is something we're really excited about, and really doing that in conjunction with other tracking in the home, whether that be fitness tracking, sleep tracking, nutrition tracking, is a really interesting kind of holistic lens that we as investors have been looking at the space. And then kind of more broadly for trends, really even geographically, right? Done a ton of work in North America and Europe, but another really fast-growing market that we're increasingly looking at is actually Asia, so definitely a market to continually keep an eye at there. And then with that, obviously, comes a lot of the challenges that we discussed a little bit earlier, but beyond even just differing payment models, it can also be just different regulations across different countries. So that often takes a lot of time in our diligence, is figuring out what the regulatory pathways really look like across different geographic settings. But in general, the past couple of years have obviously given a lot more kind of proof points of clinically backed studies. We're still early, I would definitely say, but an area that we're continually tracking. And the last point I'd add is, at the end of the day, biofeedback right now, we're talking about it in the context of healthcare. But another investor point of view is that it can also be applied to many other sectors in the future, whether that be gaming, whether that be even performance enhancement in sports, right? So there's a lot of kind of tangential areas that biofeedback may touch in the future that we're continually tracking as well.
Well, last question to wrap up our discussion, leaving some room for our audience for questions, is that looking forward ahead in the future, as more and more consumers start adapting biofeedback into the mainstream healthcare, what do you see the potential problems that people should be aware of, for example, like data privacy or other problems that come with it?
Yeah, so I think for us, we have to think about that a lot, even with some of our partnerships with Natural Cycles as an example in the fertility space, right? It's exciting to kind of be able to garner more data from users, but assuring them that their data is staying private and staying secure to them is the utmost, honestly, a concern, very valid from consumers that we have to make very clear to our users that that is going to be a top priority. So totally agree that that's a very, very important challenge for sure.
Yeah, I think from my perspective also, also like this European health data spaces is also that we have an objective, how to use the data. So what is the utility of collecting this data? What do you want to do? Do you want to improve therapy? Do you want to improve the health? Do you want to improve the patient quality of life? So what is the main thing that you want to improve? And how does this data collection then subsequently lead to this outcome? And then I see that what I see missing is this behavioral science implementation. So behavioral scientists, they study behavioral a lot. They combine psychology with economics, with sociology, with anthropology to try to grasp all different elements. Also developmental phases, that you have different age stages that you need to into account. So I think this needs to be incorporated in the whole utility of the health technology to make them more efficient and also implementable.
Yeah, and I think in terms of data privacy and regulation in Europe, it's, as a provider of data, there is a lot of regulation. It's actually a huge barrier to put an innovation on the market, which is a good thing. But there are a lot of things that are implemented, so you cannot collect data without explaining why you want to collect data and what is the purpose, which is a very good thing. So it's just, as a consumer, you just have to be careful that this company is GDPR compliant, this company is HIPAA compliant, whatever. But yeah, I think it's a very important topic that at least here the healthcare systems and the governments are taking care of. And yeah, I think it's already a very structured part of the business.
I also think maybe just one last point on that, even just when it comes to data interpretation, that's a big aspect that we think a lot about. at Samsung and Samsung Next more broadly. It's who's interpreting that data. Is it the consumer? Is it the provider? How best should we be like nudging patients about this data? A lot of it is even just like small design choices. It's like how often do they want to be nudged? How do they want to be nudged? What does that look like? So yeah, it's an interesting space for sure.
Well, thank you all for the insightful discussion. I will skip my summary so everybody can at least have a minute for a question, please. Go ahead. No. Okay, sorry, they don't have a mic for you. Can we have 1 minute? Don't kick us out.
Uh-oh.
Yep. Vitaly, Pickback Health. The question is, for example, from Samsung standpoint, what's first and what's second and what's a proportion? For example, if in like some enhancement or medical device, for Samsung, what's most important, like more revenue or patient outcome? Like what's the first one, what's second, what's the scale, and for Professor also as well, what's first for you? Like to help people or to do research or to earn more money? Like, yeah, that's a question.
It's a fair question. I wish I had the answer to it specifically, but before we run out of time, and he comes upstairs, I mean, at the end of the day, for like Samsung Health's efforts, we're always trying to figure out how to best use our data to, progress the lives of our users. At the end of the day, they're using Samsung products already. Samsung Health's not going to become another $5 billion business because of healthcare. We want to help the patients that are on our Samsung devices already, and we're excited to do so moving forward.
For us as well. But we're not officially a company, so from university perspective, we are interested to help the patients to improve their lives with efficient and effective tools. But of course, we all also need to make money because this is part of life, so this is part of the equation. But the main outcome should always be that we want to have a positive social impact. So this is the key decision that we always make as a company. If we do something or not, it's always, do we believe that has a social positive impact? Otherwise, we never do it.
Thank you for giving us the extra time.